Good afternoon and welcome to Open Classroom. I'm Janet Gillow. I'm the Director of Professional Development for the Brown School, Washington University in St. Louis. So happy to have you with us. For our friends joining us on Zoom, I just want to let you know we can't see or hear you. We also can't call on raised hands, but many of you are already using the chat feature and we love that. To send in your greetings, your comments and questions. We definitely want you to be a part of this as we go. For folks joining us on YouTube, we're super glad to have you with us. Unfortunately, we don't have a way of communicating directly with you, but thank you for taking the time to be with us today. Before we get started on today's program, I just want to let you know what Open Classroom has coming up. As we round out February, tomorrow we're doing a panel on misogynoir. We've got an amazing, accomplished African-American scholars and clinicians who are going to be talking about their experiences, helping us to imagine a more equitable landscape in the future. That's rounding out our Black History Month celebration. And definitely, we're still taking registrations. Encourage you to join us if you're interested in that conversation. Next Tuesday at 12:30, Mark Rank of the Brown School faculty has a brand new book coming out. It's called Poorly Understood, and it helps us understand better poverty in America. So that is coming up. And then just generally, as we look ahead into March, we have a series on the COVID vaccine, which launches next Wednesday, and then several policy-themed offerings, and they start next Thursday. So lots coming up. I'll throw a link into the chat that lets you see what's coming up. We'd love to have you register for future programming. I want to thank and acknowledge my co-host, Cynthia Williams, our Assistant Dean for Community Partnerships. She's here helping to moderate the chat. And today's program is extra special for us. We've got a guest moderator, my colleague, Maisha Wilcher Roberts, who's with the Brown School Evaluation Center. We work together on some things, and she works with absolutely everybody on this Better Family Life panel, so we couldn't think of anybody better to moderate this conversation. So without further ado, I want to hand things over to Maisha. Welcome.
Hi, everyone. So happy that you've taken time out of your day to join us. I think, and what Janet said is absolutely true. I work very closely with everyone on the panel. So while they're collaborators and partners, I've just interjected myself into the Better Family Life family. So it's a pleasure to be here to just have this discussion with them and you all. I'd like to begin by introducing Daryl Grimes. He is the Interim Chief Executive Officer at Better Family Life with more than 40 years of progressive and responsible experience in nonprofit management and an entrepreneur. He also has operated a home health care business, and we know how that lens is so important in this context, especially in the work that they're doing around COVID, post-COVID-19. So also too, he spent 20 years as a chief executive officer and a chief operating officer in a variety of industries, housing, healthcare, and employment services. Which lends well to the holistic approach to the services and supports Better Family Life offers. Within the context of Better Family Life, he worked for more than 20 years, but specifically 12 years as Chief Operating Officer and Vice President of Workforce Development. He is a strong advocate for employment training and housing programs. Still working on projects that include the Missouri Work Assistance Program, which offers training and employment opportunities for low-income clients receiving temporary assistance from the state. He takes part in connecting customers to sustainable job opportunities that lead to full-time employment and self-sufficiency. Beyond Better Family Life, his commitment to the region runs deep. He's worked with the Urban League, serving as a director there for over 15 years. And also has spent time supporting the work of the Robert Fulton Community Development Corporation at Friendly Temple Church, who is the director of there. On top of that, he is a husband and a father of 3 sons. And I just look forward to him having an opportunity to talk about his relatively new role and what he and his team have going on right now. So without further ado, Mr. Grimes.
Thank you, Maisha, and thanks to Washington University Brown School, Dean McKay, Cynthia Williams and the entire team. This is really a good forum, and I've looked forward to this for quite a while. But before we get started, I'm going to ask if we can do just 10 seconds of silence, because we have approached and passed the 500,000 deaths nationwide from the COVID virus. And if you will join me in a moment of silence for about 10 seconds, we'll honor them that way. Okay, thank you. Let's talk about Better Family Life. Better Family Life is a human and community development organization that was founded in 1983 by Malik and Deborah Ahmed. Malik just recently retired, and I was put in this position. But for 38 years, Malik and Deborah have been making strides in this community by offering Better Family Life and its programs. Through our mission, we are focused on a couple of different areas. We are focused on building strong families and vibrant communities. And by that, I think that we provide hope and comprehensive services to the communities that we operate our services in. It is an honor to be able to head this agency, but particularly in a pandemic, it's been rough. I'm not gonna sugarcoat this. If I had my druthers as to how we would operate or how I would come in, I would say no pandemic, but here we are and we're dealing with it. And I think Better Family Life has pivoted very well in spite of the pandemic. We've learned a lot about the virtual world when probably 95 to 97% of our programs are operated now in a virtual format. We will continue to pivot and to make changes because we don't know from day to day what's going on. We're located at 5415 Page Boulevard, right at Page and Arlington in the 26th Ward. We operate 5 other offices in the St. Louis metropolitan area. In Franklin and Jefferson County, Ferguson and St. Louis County. The crossings at Northwest Plaza is our hub for our St. Louis County operations. So we've been doing this for a while. 38 years is nothing to sneeze at. I think that we will continue to be the ones that are on the ground. Our programs are grassroots, and we look at several different areas. We basically have 5 pillars of programming, starting with community engagement and development, the cultural arts, the programs that workforce development operates. Workforce development is one of them, housing. And these programs are all put together to strengthen the Black family or to strengthen the families. Black, white, doesn't matter. We are in an age where inclusion is paramount. And that's where we're headed with our programs. Our programs must include everyone who needs help. We think that the problems in our community are very large. and they're overshadowed by the COVID-19 pandemic. But we don't want to forget, at the same time, we still have an opioid crisis. We still have a crisis of our children not being able to be in school. We're not able to hug our loved ones. We're not able to go to the hospital when they're sick with them. And most of all, which I think is just tragic, a lot of our family members have passed away because of this pandemic, and we could not be there to share their last breath, their last minutes. I think that we will continue to respond to the community, and we encourage the community to contact us, to get in touch with us, to go out to our websites at www.betterfamilylife.org. That's our website address, and talk to us. We're getting ready to embark on trying to ask the community, what is it that you need? Because many times they're not even asked. We tend to assume that we know what the community needs automatically. But we're gonna take that a step further and start to ask, what is it that you need in your community that will make a difference? I think everything is in our name, Better Family Life, and that's what we're trying to do. I want to quickly start to talk about the impact that COVID-19 is having on Better Family Life and its programs. Our programs are really designed to balance individuals and families, and we've been deprived of equal access to quality programs and essential resources. But COVID-19 exposure is unbelievable. It's incredible. We're still pushing and advocating that you wear your mask, that you social distance, that you do proper hand washing. All of these things are what we will continue until this virus has taken a turn. We will continue to advocate. I will move forward by asking or talking to you about our staff. Our staff on our panelists are Jacqueline Bland. Jacqueline Bland is our Vice President of Human Resources. I'm gonna go through these quick introductions. Steve Ingram is our Workforce Development Senior Director. Tyrone Turner is the Vice President of Community Engagement and Development, and Erica Driver is our Senior Director of our youth programs. So that's my team. And I think that we have a short video that we're going to show at this point.
We do. You ready?
Mm-hmm.
Perfect.
Over the last year, COVID-19 presented many challenges to our community. Loss of employment, lack of food and health resources, lifestyle shifts to homeschooling and understanding safety precautions to protect our elderly and those with pre-existing conditions, increased depression, and a dimness in hope. Yet through these trying times, we heard the war cry for help and have continued to keep our doors open to serve our community day after day, providing online resources, providing food, health awareness resources, being a testing facility, financial assistance to those in need, supporting minority businesses, programs for our youth to learn, shoot, and score a brighter future, building new partnerships, and recognizing others. We can't always go at it alone, but together in this day and time, we can help each other create and have a better family life.
And those are just a few of the things that we do at Better Family Life. After 38 years of existence, we continue to service this community in the metropolitan area. Like I said, we have wide tentacles so that we can reach out. Again, we can't do it by ourselves, and we're asking for all of the assistance that we possibly can get from the community first. Again, we are here for the community. And I can't make that any plainer than saying it that way. We are here for the community. At this point, I'm going to ask my team to chime in, starting with Jacqueline Bland. Again, she is our Vice President of Human Resources and also one of the leaders in our COVID response team.
Before Mrs. Bland gets started, I'd like to invite you all to add any questions to the chat as they come up for you all. I'll track them and make certain that they're addressed as we move through the presentation. Thank you.
Thank you, Daryl. As with most organizations, HR here at Better Family Life has had to make some adjustments during COVID-19. The role of HR has been to educate our staff and the clients and those who enter our facilities on the COVID-19 procedures, just to make sure that we follow our CDC regulations and guidelines. We too have been affected. We've had employees who have tested positive. We've had employees who've been exposed from others. Unfortunately, one of our employees passed away from the virus on the onset of COVID-19. What was our priority when we decided, when this virus came out? We needed to jump into action. We needed to build a team. We formed a response team, a COVID-19 response team, which pulled together resources and ideas of how to make this virus less strenuous on our employees. We have an official contact tracer, who is myself, by the way. We have a guy who works with our sanitation and disinfection within the organization if there is exposure. And on a weekly basis, we do have a company to come in and do hydrostatic cleaning. So what we're doing is we're making it available for the employees to be safe within our organizations and the community. We have passed on kits, PPE kits to our employees with hand sanitizer and mask, which is to be worn at all times. We continually educate our employees on the safety of COVID-19. We want to make sure that they understand when there are signs and symptoms, they take heed to what's going on. If you're not feeling good, we're asking them to stay at home, practice good hygiene, practice social distancing. Wear your mask as regular as possible. If you're outside of your particular office area where you're not sharing a workspace, we want them to make sure that they wear their mask. We have in place modified physical workspace. We have a workplace protocol, social distancing of 6 feet, and no congregating, or as less congregating as possible. We put together an internal COVID-19 plan, which starts, and we follow all the CDC regulations and guidelines. Once you arrive at our facility, we have health screening questionnaire to be completed. In our new system that we have a contactless temperature screening system, which has been really good. We don't have to worry about papers and pens and things of that nature. We monitor and sanitize regularly as throughout the building as people are moving to and fro. So we are really big on making sure the virus is not spread any further than it should be, or it's not spread at all. What should we do if someone's exposed to COVID-19 in the workplace? And again, we have had confirmed cases. That's been identified. We've interviewed those people. We've encouraged testing to those coworkers who were potentially exposed. And we did a trace from that particular person who had the confirmed exposure back as far as we could to make sure those outside of Better Family Life were contacted to make sure that they were notified as well. We've also been in partnership with Athenia Healthcare and Care St. Louis, who has done on-site testing here at Better Family Life, free COVID testing. As of this morning, Better Family Life is also partnering with Mercy Hospital for pop-up COVID vaccination events. That's really big to us. We are waiting on dates. As soon as the dates are available, we will put them out into the community. Of course, signing up and registering for those COVID shots are important. So we want to make sure we as a community called Better Family Life, we are out in the community helping with this virus not spreading on, and to hopefully, sooner rather than later, have this virus go away. So that's what we're doing here at Better Family Life. Those are the adjustments we've had to make. And we do continue to educate our staff. Whenever there's something that I receive from my colleagues, I share with the staff. So we want to just keep up the good work, and we want to make sure that our employees as well as the community is safe. Thank you for your time.
Thank you, Ms. Bland. So I have so many questions top of mind that I selfishly want to ask about time spent and budgetary impact and all of these constraints that I know you've had to be nimble in dealing with. So some of you may have those same questions as well, but I think it would be important for our next panelist, Tyrone, just to provide a bit more context about some of the issues that are impacting the actual Better Family Life handprint. And then, to allow Steve and Erica also to talk about their adjustments and save the questions for at the end. However, if there's something pressing in the chat, like, let's make this a conversation. Like, if you just really need to ask it, let's talk. Because, sometimes we just gloss over the nitty gritty. Please put it in the chat and I will definitely interject and make sure the panelists address it. So, Tyrone.
Thank you. Man, I'm so excited to be here again. Brown School at Washington University. I appreciate you all allowing us to have this time. From a community engagement and development standpoint, we've attempted to address some of the food insecurity needs that immediately popped up as soon as COVID kind of gripped the nation. And so one of our key initiatives was to distribute food. And so we did that. Pretty much continually throughout the summer into the fall months. And, I'm excited that we were able to respond and so much support came in. We also were able to offer testing, as Jacqueline has stated. For much of the work that we do, many of the communities that we serve, they simply have a major distrust of those who have traditionally been responsible for their care. And so some of our role in the community is to kind of be the stopgap or be the organization on the ground in the neighborhoods that are representing that interest and making sure that the folks that oftentimes look like us get the resources that they need. And so I'm excited to be able to represent, I don't want to call it a rebirth, but a support of existing life that's already in the neighborhood. We have our page revitalization initiative that has been challenged because of COVID. We want to make sure that we're able to connect with community, connect with residents as we are developing and moving forward. And when I say develop, I mean develop not just the brick and mortar structure, but all the supportive services that Better Family Life offers. We want to make sure that we're effectively deploying that into the neighborhood. So not just housing services that we do offer. When I say housing services, we help folks get into homes for the first time. We counsel people who are existing homeowners. We have folks who may be in the midst of some sort of challenge with their landlord, so we handle challenges with landlords and addressing those. We offer financial literacy support for the neighborhood. So we try to do a lot around asset development, but we want to make sure that in this revitalization effort that we're as inclusive as possible. And so we don't want many of the challenges that have plagued us in the past to continue on in the future. I mean, we believe that we have not the answer, but a good response to many of the needs that are in the community. And for the better part of 38 years, we've been doing that as an organization, and we look to continue to do that in the future. I wanted to make sure I added, a couple more pieces in. We've kind of expanded some of our efforts as it relates to remediating violence and addressing violence. And so gun violence is always going to be a tough situation to handle. And so what we're looking at now is expanding our efforts and really looking at root causes as it relates to violence, and how can we start to address some of those not just systematic issues, but also cycles within families that often escalate into violence. And so we're looking at initiatives and implementing initiatives throughout not just the single city area, but also into the county overall. Every about 3 years or so, we commit to assessing what's going on in the neighborhoods. We have a community impact measurements tool that we evaluate the needs of the community. Again, COVID-19 kind of hampered some of the efforts, but we like doing hand-to-hand pressing of the flesh, if you will, to make sure that we're understanding community needs. However, we were able to complete, I think, a pretty well, and we'll be releasing the results of that very shortly, but a really well developed, and thanks to the help of Maisha, of course, assessment for the neighborhood to really target what does the neighborhood of Hamilton Heights need, what can we do to support the West End neighborhood and all the neighborhoods that are real key to our handprint. I won't go on and on because I can. I want to make sure our other panelists have an opportunity to talk. But I'm excited about our work, and I'm glad we're here to kind of talk a little bit more about it and let people know we're here to continually serve. So thank you.
Thank you, Tyrone. I'm glad you mentioned that community needs assessment, because certainly some of the stakeholders that are on could benefit from hearing all of the adjustments you made to get that data collected in the midst of a pandemic. I mean, it was pretty remarkable.
Yeah, we had to do, oh man, we were, it's always difficult for us to do initial assessments when we can't physically touch each other. And that's been some of our primary way, but we've used mailers. We've had engagement from online perspectives. We've used bait of some sorts. We've had some folks complete surveys, and we were able to distribute some gifts to be able to participate. We've done a lot to try to make this during these times as responsive and responsible as possible. And so this assessment is so important because it gives us a direct blueprint of what the community needs. It's not our guess. This is not about just Better Family Life. It's about what does the community really need and how can we serve during this particular time? Because my personal belief is, unfortunately in America, if America catches a cold, then oftentimes in the Black community, we catch pneumonia. Well, we're in a space now where we, as a nation, we have an unprecedented pandemic that just pushed past 500,000 deaths. And so for us, we have to be immediate in our response, and we need support from folks to help us do that work. We're looking to work with with anybody that wishes to kind of help further the mission of the organization. And we have a lot of the tools here, and we would hate to have a lack of capacity be one of the reasons that we're not able to really effectively address many of these issues. But yeah, we're on it.
Thank you for sharing that. So to that end, before we transition to Erica and Steve, who probably could also speak to, and you as well, actually everyone could talk about how you all are funded, how you've sustained funding, things that you've had to do to adjust to implement these programs that you're describing. But one thing that I think that all of us that are here on the panel take for granted, but it's probably important to clarify, is that you all refer to the community surrounding Better Family Life as the handprint. You know, typically people refer to it as the footprint. So I think that it is worth anyone that is here on the panel to address what that means to you all as an organization.
Well, I'll take a stab at that. You know, so often when we refer to the people we serve or the area that we serve, we call it a footprint. Well, footprint implies you're stepping on something. We don't want to put a foot on it. We want to put a hand to it. We want to make sure that we're supporting people and are close enough to be able to shake a hand. I mean, it takes quite a bit of effort for us to be able to get close enough to the community where they're willing to reach back and shake our hands. And so for us, we want to make sure that the concept of a handprint is the new dynamic of how we refer to people that we are, you know, responsible to and attempting to help uplift in some sort of way. So for us and for me personally, I always refer to the area we serve as handprint because we want to make sure that we're touching and not stepping.
Thank you for sharing that. The other thing I want to mention is everyone's been just so formal, but you heard Ms. Bland discuss how she was involved with tracing. And, you know, Mr. Grimes, who is the new CEO, interim CEO, has his hands on program implementation. So while they're presenting like so formal, I mean, I think that this symbol that's in the middle that we definitely want Erica to address when she speaks. Really reflects the spirit of this organization. And I'm glad you all are having the chance to get a sense of that. So before I hand off to Steve and Erica, in the chat, we've had a couple of questions. I definitely want to get back to the Mercy vaccination pop-up because that is so awesome and amazing. But specifically, there have been questions about funding, how BFL is funded, how you've sustained funding, how you've had to make adjustments in the midst of COVID, you know, to programs that might require, you know, like hand-to-hand contact, as you refer to. And then the other thing too, people want to know if you're still collaborating with churches. Anyone could speak to that, but certainly this symbol in the middle is something I've been asked about. So Erica and Steve, that's a huge handoff, but here you go.
Well, I definitely will let Erica give the spiel about the symbol. Let me say, as it relates to workforce and what we experienced through COVID in the early days, in the early stages of everything, I guess after we shook ourselves back in place and caught our breath from the blow that we all took, it was important for us to figure out what we needed to do to keep services moving. We knew that the need was going to increase and that we had the resources that the community was going to need during that time. We experienced a lot, and there's nothing like a time forcing you to innovate, because we were definitely forced to innovate in a lot of different ways, going primarily virtual and figuring out different ways that we could continue to contact our participants. Within our workforce programs, we have the Missouri Work Assistance Program and our Skill Up programs. The Missouri Work Assistance Program works primarily with those who are receiving TANF benefits. Skill Up program works with those who are receiving SNAP benefits. These are two training to employment programs where we offer a plethora of services that include training for credentialing, employment placement, retention, childcare assistance, rent utility assistance, you name it, we offer quite a bit of supportive services to that regard. The one thing that we knew is that we could not take for granted that because we've been doing this, we had all the answers, because we knew that we did not at this time. None of us had experienced a pandemic before. So we were intentional in being agile, stopping what we were doing, connecting with those who we are serving to find out what their needs were to inform our practice. We knew that if we did not do that, when things started to get better, we would have a bit of a challenge in terms of serving. And so we were intentional in doing that or pivoting and making strides to continue to do what we needed to do to serve the community. And from a programmatic perspective, Erica will be able to share quite a bit more about what took place in the youth department as now serving our Vice President of Youth, Family, and Clinical Services. Erica?
Thank you, Steve. So as they were mentioning earlier, I was going to break down our logo that supports Tyrone's statement about the agency. We are a hand up. Our logo is actually two adinkras put together, any I may, any I me. That means one should not bite the other except for God. So with that guiding us in our efforts to support the community, we're not trying to hurt each other. We're trying to support each other and move each other along in the process to success. And we do that through hands versus your foot. So, and as Steve pitched to me about the efforts we've done thus far, we in the youth department believe the most single entity that supports our community is the wellness of the children. And to take words from Dr. McCoy, if our community is unwell, then our children are unwell. And COVID exacerbated a lot of things that are going on in our community as it relates to youth. And during this pandemic, what we encountered with our services was we had to shift our model completely, because we're an in-school person, face-to-face with kids. We're seeing about 7,000 kids on an annual basis in the schools from St. Louis City, St. Louis County, and St. Clair County, Illinois. And so when we couldn't get to them, we immediately went to, okay, let's do something, engage the kids, because none of our schools were ready to immediately jump in and provide a virtual implementation model. Some of our schools, we even were the hands that took the packets to the youth, to their front doors, like, hey, here's a work packet, work on this to help maintain what you've learned thus far in the school year. We were also the ones calling the family, like, what do you need? Let's get you to support, using our linkage with community outreach and saying, hey, we need some families that need food. Can we get additional boxes for us to deliver, and put them in the agency vehicles and taking them over there? So we've been working at it slowly. Also with that, we shifted to doing online participation for our families. We provided a parents' advocacy training for parents to learn how to advocate for their child in this new paradigm. We also provided an opportunity for our families to engage in a family bonding in our virtual cooking classes, which was 3 classes with a licensed nutritionist, talking to family about portion control, how to use the foods you have at home, how to make using vegetables in your food fun. We also had our B-Fly TV, which is on our YouTube channel, in which we promote stretching with Samantha, motivational minutes in the morning, story time, and so forth. These are all efforts we made to provide that social emotional development that was being missed because everybody wasn't interacting with each other in the normal way. Also with that, we have sought out additional funding to support our families, because COVID's impact didn't just impact the school. It removed kids having access to that school-dependent meal. So sometimes kids got breakfast, lunch, and dinner at school with our programs. So we tried to shift that as well as provide that support for families. If you go into our programs specifically, we are now learning that there's 4 different models that we've implemented our program over Zoom to our youth. We utilize socially distanced sports such as golf this year to give youth the opportunity to still be engaged in activities. Our junior PGA team, they're gearing up for the next semester too now for golf, but that's a socially distanced activity that youth can participate in as well. It's so much that we've been doing, but also I want to talk about our humanitarian efforts, which with St. Louis County, in which we saw that there was a need for resources with housing and mortgage assistance and utility. And partnering with our workforce department, we were able to help isolate those who needed it, that they couldn't provide services for, or that we couldn't provide services for, so that a broad reach of people were able to be served during this pandemic, and no one was left without. And even if we didn't have the resources, we sought out, and I commend the team for seeking out actual people versus, oh, just go call this agency. They actually had people you can call, talk to Nicole. She's going to give you an effort. She's going to be your next person you talk to. If she doesn't call you back, call me back and I'll call her. So those were things that I know across the agency we did to show our community that we care. And my staff just adjusting to everything, making phone calls from their personal cell phones, their home phones to clients, to students. I've had parents who see me out in the store with a BFL shirt. I was like, hey, one of your people called my kids this morning asking, did they do their homework and do they need any support? And I was like, really? Wow. So it's real. And to hear that from people saying that they appreciate that in an environment that I wasn't looking for somebody to recognize me it's unbelievable.
I can attest to that from a personal perspective. All of my sons can't wait for summer because they want to go to camp at Better Family Life. And honestly, the discussion just this week, I kid you not, was I get to move up to the next age group. Do you think they're going to have summer camp? Like, that was a discussion because he's looking to be with the age group. And then the youngest son was like, well, I'm interested in my age group, but I want to see the counselors, because they're college students, who they like love to be around and listen to. And so that's just my little personal interjection. One thing I want to do, I want to definitely shout out Miranda Jones, who was in the chat and here. We love you, we miss you. And I want to say, great job. Did you not train Erica up? And is she not delivering? Killing it for sure. And also to get back to the chat, and I know, Steve, you can speak to this. So there are some questions in the chat about anything that you all have done to support job placement. This idea that people are underemployed, can't find employment, but there's still jobs that are available. People are just not sure how to move in this time and space to connect with them. Can you maybe speak to that challenge? And if you all have anything that you've been doing to kind of fill in that gap?
Yes, you know what? It has been an extreme challenge. We've seen both ends of the spectrum when it comes to placement. One of the challenges, Maisha, is that now with so many having been unemployed, the pool is so full. And so opportunities that are there today may not be there on tomorrow. And so one of the things that we've been doing with all of our participants have been working diligently to make those connections, to connect them with employers that we have in our network who use us as a trusted and reliable referral source so that we can connect them to those opportunities that are out there. Now, on the other end of that, you also have a number of folks who haven't wanted to come out. Folks are rightfully so that they have their anxiety. They're working from home now, or not working from home, they're educating from home, doing homeschooling. And so finding schedules that fit is also a bit of a challenge. But I think as we have been progressing and we've gotten past the seasonal hiring period, we're starting to see a bit of a turn to where there's more opportunities that are being there. So our employment team are working hard to connect with those employers, let them know what we're doing, make sure that our participants have the credentialing that they need so that they can be competitive with the opportunities that are out there. And so it has been a tremendous effort, but we're doing a really good job at it at this point.
Thank you for sharing that. So what I like to do is just sort of transition and open it up to all the questions that have come through the chat, which are not necessarily program or service specific, but maybe something that you all could jump in on. And I definitely want to leave time to talk about the Mercy vaccination pop-up because endless questions have come through about that, and that is awesome and amazing. Again, selfishly, I gotta just big up Erica and her department because even in the midst of COVID, if she could tell you the number of youth that they have stayed connected with, you would be astounded because I'm dealing with her data sets. and I'm astounded. No,
down.
They have
about 7,000 kids. So even doing 900 from June of 2020 to December, 700 kids, or 975 kids, that's still a lot, but it's not a lot for us. We kind of feel it, like, we're like, I'm not doing enough. We're like, we are.
We were teasing her about how her name sounds like she should be a celebrity, you know, Erica Driver. So just you wait and watch to see, you know, what Erica Driver continues to do in the department. I just had to say that. So questions have come up about all kind of programming. If you're a church, how do you connect with Better Family Life? If you want to send your kid to summer camp, where do they go? Anyone?
Maisha, let me first address the Mercy Healthcare piece. This is the newest initiative in that we're still putting all of the pieces together. We want to make sure that first we put information out debunking some of the myths that are going around about the vaccine. And so we will be having a series of informational sessions with the community so that they can ask questions and get them answered. Also, we will be, this has been designated as a vaccination site for their pop-up vaccinations. We are still putting it together. And if I had to guess, I would say we're probably about a week and a half to 2 weeks away from the actual implementation, and we'll keep the community posted on exactly when and where. I do know that it will follow the guidelines as put out by the feds and the state as far as tiering are concerned. So the 1As and the 1Bs, it's going to follow that same thing. But I think that to have a site right in the heart of our community is monumental. You know, a lot of people don't have access to transportation. We've even talked about using our buses and our vans to help out in this area. We still have to be mindful that we are in the middle of a pandemic. And so more information is going to be coming out. Again, if you go to our website at betterfamilylife.org, you'll be able to kind of keep up with when this is going to actually occur. But Mercy Healthcare has been so gracious to do this, and we asked because we really need it in this community. So that's the newest initiative. One real question about the funding. I want to get to that. We are funded in various ways. A lot of our funding is through state and federal contracts. We deal a lot with getting funds from foundations, but we're now headed toward sustainability and operating programs that are going to be income generators so that we can be less dependent on government dollars. And I think that that's where the Page redevelopment initiative comes in, because our first effort at doing 200 houses are going to really make a difference in this neighborhood and in the houses that we are either restoring or building from the ground up. But that is a method of sustainability that Better Family Life has lacked in the 38 years that we've been in existence. So now we are really kind of bullish on making sure that that happens. It's not only to just to have new housing, but a decent and affordable housing is our aim. So you'll be hearing a lot more about that, and we're going to be very public as we move forward.
Thank you, Mr. Grimes. So one question related to the Mercy vaccination pop-ups. Um, Danielle asks, speaking to the tier system, will your pop-up vaccination site start at the tier 1 level our region is currently at, which she says is phase 1A? I
That
don't, go ahead. I was gonna say, I don't know anything about this. Miss
yeah,
Glenn, Daryl, save us.
this believe it or not, this is new for us too, because we just went into these negotiations. And that was a question that was asked. And they answered it by saying, we just can't open up the doors and let everybody flow in, that we're gonna have to follow those tiers. And I believe the 1Bs now have been activated, if I'm not,
Yes, that's Danielle just added that to the chat. She said it's
yeah.
actually 1A, 1B tier 1. This sounds like Mandarin to me. 1B tier 2.
Yeah, I'm I had to look at making that decision for me and my family. I had some of the same questions as the community has about the vaccine, but again, I weighed it out. I want to be as safe as I possibly can. I want to be able to be knowledgeable enough to let people know that you can get the vaccine and still make sure that you're doing everything in your family so that everybody can be safe. I just weighed the options. It's better for me to have the vaccine than not to have the vaccine, but we definitely cannot make up your mind for you.
I mean, I think that also too is sort of the beauty of this collaboration, because we know that in terms of messaging, it will be culturally responsive and, reflective of the handprint's needs and the demographics that's there. So for me, that's one reason why this is a fascinating collaboration. And I definitely look forward to hearing more about how you all roll it out, because I think other communities and organizations could really benefit, from that insight.
Right,
This is amazing. Another,
One more thing, and Tyrone can chime in on that, because I think I heard you say something. It was a question about churches and how
yes.
we work with churches. Tyrone, do you want to talk about the churches?
So the church for us is still a key anchor in many of the neighborhoods that we serve. And so for those who are interested, you can definitely call us 314-367-3440 extension 715. Ask for
Repeat that one
Jihad.
more time. I'm
I
gonna put it in
will.
the chat.
314-367-3440 extension 715. Ask for Jihad. We've been coordinating efforts with a few of the churches with distributing PPE to the neighborhoods. One of the things that we don't want to do in this last, what I'm hoping is some of the last parts of us as a collective dealing with this pandemic is to get to the end where we may all really be making some significant grounds and fumble and not still be safe and lack connectivity to the basic resources like masks. But yeah, we for sure still work with churches. We're still connecting and making sure that we are using the church as a hub in the neighborhood. There's so many that are still out there that even for many of the churches, we're looking to put together a program to help support some of the work that they do on a day-to-day basis. We all are dealing in spaces where we have to connect with people like we are now, but many of the communities that we serve don't have this ready access of a Zoom account or stable internet access or anything beyond what they may have through a cell phone. That's some of our challenge. We want to be the organization that just doesn't address sophisticated treatments of symptoms. We want to go to root causes. And for us to get to the root cause, we have to be more deliberate and more conscious about who we're talking to, how we talk to them, who's represented in that aspect. And to Maisha's point, as culturally responsible and culturally conscious as we can be, I was on another panel discussion last week, and we were discussing the importance. Like, so if you ever come to our facility, or when we're able to open again, we have one of the largest African American historical pieces depicted on our wall. It's a 80-foot long mural that depicts the origins of man from creation all the way into the future, and these are historic images. And so it's important for us to be able to connect socially in a responsible way that represents positive images of Black and brown folk who have persisted in this struggle since we've been here in the last part of this century. So, but I'm again always excited. I know we're winding down. I don't want to monopolize too much of the time, but we're for sure working with the church.
We have just a few more minutes. There's one question in the chat remaining, and that had to do with the question was if you all have any sort of supports or processes in place for people that are uninsured, as we know that population is increasing in this context.
I think that I'm sorry, with our healthcare partners, that's something that we really need to start to take a look at. Our partners such as Affinia Healthcare and CARES STL and some of the other ones, Mercy System. You know, I'm often asked, what is the hope for the future in St. Louis? What is my hope? And my hope is that we can collectively come together in a unified way to address the problems in our community. We're still too fragmented. We're still too separate, and we need to come together. The old Queen Latifah song, UNITY, unity. That's what we need right now. We really do need unity in our neighborhoods, in our cities, in our counties, and that's my hope for the future for St. Louis, that we will come together and stop worrying about the small stuff. There is enough problems to go along for everybody. And if we put our heads together and our minds together, and we have some great minds in our neighborhood, we can come together with some collective solutions to a lot of the things that are going on. But there are many, and we are asking our cohorts, other agencies to get in touch with us. We're asking for more funds because we need funds in order to stay in existence. We were able to secure the PPP funds for payroll, but as you all know, sooner or later that runs out too. So we are putting the challenge out to St. Louis to work together. And I think we'll be a lot mightier if we come together as one and stop being as fragmented as we are.
Well, I think that is a perfect concluding point to this time that we've shared together. If you're like me, you probably still are now bubbling with questions that you'd like to ask of them. So I know the youth department has their own specific site. There are questions about college applications and camp that came up in the chat. I believe that's www.bflyouth.org. Please.
We actually have we're partnering with the Historical Black College Corporation for St. Louis and alumni, and we are partnering promoting youth and learning about the Historical Black College Scholarship Fair that's coming up in April. So check out our website to learn more information so you can register and get those scholarships.
We are right at 1:30, but panelists, if you have one word that you'd like to leave our guests with, what would it be? Maybe two.
Unity.
Unity.
Let's do it.
Let's do it.
That's 3.
Thank you.
Ty, what about you?
Love. We need a little bit more love. Be more patient with each other. Love.
Erica?
I got 6 words. Past is a place of reference, not a place of residence.
Love it. Mine would be Ubuntu. I am because we are. We are because I am. Have a wonderful remainder of Black History Month, but don't let it just end there. You know, at the end of
Yes.
February, let's do it, like Miss Glenn said. And thank you all so much for your time.
Thank
Happy
you.
Thank
Wednesday.
Thank you all.
Thank you.
And thank our listeners also.
For sure. Thank everybody for showing up, for sure.
Yeah, much gratitude for sharing this moment with us. Thank you all.